Welcome back to part 89 of our 100-part CPC exam series. I am absolutely pumped to have you here today. But hey, before we dive into today's masterclass, make sure to like, share, and subscribe to Decode Healthcare with Harshal. All right, today we are cracking wide open the CPT medicine section. We're going to focus on the specific rules that literally trip up countless test takers: immunizations, injections, infusions, and hydration therapy. Let's get into it.
This explainer is a crucial piece of our rulebook deconstructed arc. So, on today's agenda, first, a quick welcome to the medicine section. Then, we'll tackle dual coding for vaccines, master those tricky hydration therapy time rules, differentiate between injections and IV infusions, lock down the ultimate coding hierarchy, and finally, wrap up with a cheat sheet and a sneak peek at part 90.
All right, section 1. Welcome to the medicine section. You know, to actually master these codes, you got to understand the landscape we're walking into.
So, the medicine section spans CPT codes 90281 all the way through 99607. Think of this area as a giant catch-all. It covers all those non-invasive and minimally invasive diagnostic and therapeutic services that just kind of refuse to fit neatly into EM, surgery, radiology, or path and lab. But a quick warning for you, CPC exam questions in this section are fiercely rule-driven. You've got to really anchor your thinking on specific time thresholds and add-on logic.
Moving on to Section 2, Dual Coding for Vaccines. Let's pivot to our very first massive exam trap.
This brilliantly illustrates the golden rule of vaccines, the two-code requirement. You must always, and I mean always, code the administration and the product separately. Step 1 is the actual work of giving the shot. You'll find that in the 9460 to 9474 range. Step 2, that's the liquid in the vial itself, the vaccine or toxoid product, located in the 90281 to 90749 range. The exam absolutely loves to test whether you remembered to report both parts of the equation.
Now, check out how the administration codes split based on age and counseling. This is huge. For pediatric patients, so age 18 or under, the absolute keyword is counseling. If face-to-face physician counseling is documented, you use 90460 for the first component and 90461 for each additional one. But if the patient is 19 or older, or if there's literally zero counseling documented for that child, you instantly jump over to the 90471 family. Never ever assume counseling happened unless it is explicitly written in the text.
Okay, Section 3, Hydration Therapy Time Rules. Let's see how this builds our understanding of time-based coding. First things first, let's lock down the definition. Hydration therapy, codes 96360 and 96361, consists of prepackaged fluid and electrolyte solutions. Think normal saline or D5W, administered intravenously without any added pharmacologic agents. The very second a therapeutic drug goes into that IV bag, it is no longer just hydration.
So the crucial magic number you need to burn into your brain is 30. If the hydration runs for 30 minutes or less, it is completely bundled, meaning you do not bill it separately. It just vanishes into the encounter. You absolutely must cross that 30-minute threshold to bill anything at all.
Here's the math you need to memorize. For your initial IV hydration lasting anywhere from 31 to 60 minutes, you report 96360. But what if it goes longer? Well, you use the add-on code 96361 for each additional hour. However, the rule here is strict. You must push at least 30 minutes into that next hour increment to actually claim the add-on code. Time is truly the ultimate gatekeeper here.
All right, Section 4, Injections versus IV infusions. Moving right along, let's step into the therapeutic, prophylactic, and diagnostic space.
I highly recommend you take a screenshot of this right now. This table is your lifeline. The dividing line between an infusion and an IV push is exactly 15 minutes. If it's a continuous administration lasting over 15 minutes, up to an hour, it's an initial infusion, code 96365. But if it's 15 minutes or less, or a direct bolus, it's an IV push, code 96374. Your add-on codes shift entirely based on this single time distinction.
And a quick warning here, do not confuse your routes. Subcutaneous and intramuscular injections have their own distinct code, 96372. If the vignette says IM injection, don't drift into IV push or infusion codes. The route absolutely matters.
Section 5, the ultimate coding hierarchy. We are now at the climax of today's explainer.
So, you've got a patient receiving multiple services at once. How do you sequence them? You must always code the highest level service as the primary initial code. Step 1. Infusions take priority over push injections. Step 2. Push injections take priority over hydration. Simply put, therapeutic and prophylactic substances always beat hydration. Since therapeutic interventions require much more intensive monitoring, they dictate the primary code. Hydration is literally at the bottom of the totem pole, usually bundled unless it's explicitly documented at a totally separate site or encounter.
Stop right here. Burn this into your memory. You are only permitted to select one initial code per patient encounter. The exam will definitely try to trick you into billing multiple initial codes for different drugs. Do not fall for it. The only exception is if the documentation explicitly proves 2 separate IV sites were medically necessary. Otherwise, pick your primary code based on the hierarchy, and the rest are just add-on codes.
Section 6, Cheat Sheet, and Part 90. You guys have done fantastic work today. Let's quickly wrap this up.
Here is your one-page visual summary. Remember dual coding for vaccines, the strict 30-minute survival rule for hydration, the 15-minute split for infusions versus push, and that relentless primary hierarchy. Grab a picture of this. Next time in Part 90, we're tackling Medicine Section Guidelines Part 2, diving into psychiatry, biofeedback, dialysis, gastroenterology, ophthalmology, otorhinolaryngology, and cardiovascular codes. Phew, that's a mouthful. Until then, I leave you with this provocative thought. If a patient receives highly complex chemotherapy and hydration in the exact same visit, based on our hierarchy, which one completely dictates the initial code? Think about it, keep studying, and I will see you in Part 90.